goes. Okay, we're on. All right. So.
And you're going to edit all this after, so we look good.
Well, yeah. Well, I cut the beginning and I cut the end, and I try not to do anything in between because it just takes up too much time.
That's hard. Yeah.
All right.
Yeah, sounds good.
Okay, here we go. Another episode of TNT Weekly, and I'm here at the Mecca, the heart of arts and culture in our community, the Gibson Center. I want to thank them very much for allowing TNT Weekly to host here. Look into their programs and events for planning, anything you'd like. They have some really great packages, all COVID friendly. And I know they're looking into streaming and doing some wonderful things here to work in parallel with what's happening out there with COVID and stay safe and everything. So remember, without arts and culture in our community, the community is just It's just
That's agree. Beautiful building. Beautiful.
Really, really happy today because this gentleman, just over the weekend, I was thinking about, how we're getting into the second wave, COVID, and I'm sure everybody's stress levels are up there. And I reached out to this gentleman, and immediately he said, I'd love to help you out, Tony, and see if we can, better inform the public. And I wanted to try to get some sort of information out there with this podcast, and he's given me his time. Really, really happy to have on the show the Chief of ER at the Stevenson Memorial Hospital, Dr. Myatt.
How you doing?
Good.
Thanks for having me on. Really appreciate it.
Oh, you're really, really super welcome. Thank you for your time and everything.
My pleasure.
I know where I want to direct the podcast, but first, like I do with all my guests, for those of you that know you as a physician, can you sort of give us a little sort of brief summary on your schooling, where you grew up, and really at the end of the day, what drew you to Alliston?
Oh boy. Yeah, so actually I grew up in Owen Sound, Ontario, just about an hour and 15 or an hour and a half from here, northwest, in a small town called Leith, actually, is where I grew up. It's just outside of Owen Sound. Went to high school in Owen Sound, and then moved to Toronto to do human biology. At that point, I was pretty sure I wanted to go into medicine, so I did that. And then, it's a really competitive thing to do to get into medicine, and coming from a small town, moving to a big city, I made a couple of, mistakes, I would say, a freshman year thing. So I had the opportunity to do a dual degree, which is a master's in public health and an MD degree after my 4 years of undergrad, and I went to Grenada, West Indies, and I did this dual degree there, and then I came back and did my residency in family medicine at the Northern Ontario School of Medicine in Sudbury. The reason why I went to Sudbury was because it felt so much like home. Mm-hmm. It's a bit smaller town. It's not big city. It didn't have that big city feel. So that's why I went there. And then my last rotation of my very last year, I came here and I rotated with Dr. Oswaldo Ramirez, who still was the chief of ER at the time and still works there. Subsequently was the chief of staff and still works a lot in the emergency department and in the community. So they were so welcoming, and at the time there was a recruiter named Kate Mui who was instrumental in recruiting so many of us physicians at the time. Started around the same time as a couple of other physicians, Dr. Khalil and Dr. Safar. So we really felt welcomed and really appreciate the town for sort of taking us in.
Yeah, right.
And it's been great so far.
Wonderful. And when I first met you, you were really focusing quite a bit on family practice, right? And your patients and your rostering, and from my understanding and knowing you a bit, and your associates, that the world of the hospital and working in the hospital in ER is much different than family practice. And now here you are, chief of ER. So, what motivated you to stay in the hospital environment versus family practice? Because I understand it's really difficult to do both. You're working 24/7 already, right?
It is really difficult to do both. I moved into the hospital. Actually, I never wanted to do ER, to be honest, but Dr. Ramirez was insistent, said I had what it took to do ER, so that sort of allowed me to stay in the ER.
Yeah.
And then really it was based on community need. I mean, Dr. Ramirez was moving to chief of staff, and the ER needed somebody who I felt needed somebody anyway, was local, and who really cared about the community, and I was kind of next in line, and so I applied for the position and interviewed, and I was a successful applicant.
Wonderful. Moving forward into the hospital environment and maintaining that subject, I know that the community and the hospital has had initiatives to expand the hospital, and Jody Levesque and his executive team have been very, very supportive and aggressive on getting funding and pushing that forward. The community has supported it well, but I understand at the end of the day, it's a government decision at the end of the day. But I know we're getting closer. I know you probably don't have the answer, but it's something I know the community's looking forward to. Do you see that coming to fruition in the near future, Matt?
Yeah, near future, I'm not sure, but it has to happen, sometime soon, because we're just running out of space and the community's growing so quickly. You're absolutely right. Jody Levesque and his executive team have been champions of redevelopment. In fact, I wouldn't say it's Jody Levesque's sole focus, but probably his main focus is getting this redevelopment. Mm-hmm. It's been on the radar since 2011, at least, when I came here. Yeah. We've been having meetings about this and submissions, and it's been challenging to move forward, because we know we need it. We know this community deserves it. It's our turn, essentially, to get this redevelopment. When it's going to happen, it's impossible to say. Yeah. With COVID, everything sort of slowed down again. I do know that stage 1 has been accepted. That was recently announced in the news, and that's a big deal. Once you get past sort of stage 1 and stage 2, things supposedly start to flow quickly, but we really have no idea. I wouldn't want to give a timeline because I don't know, but what I'm hoping for is 2025, 2026. Could be longer, could be sooner.
Yeah, less. Mm-hmm. And that focus on redevelopment for our listeners or new residents into the community is mostly on the expansion of the Emerge, right? Or is it an expansion of rooms as well? Mm-hmm. Do you have sort of any outline on the expansion plans?
Yeah, it is a lot of updates. We do have tentative blueprints that you have to submit, of course, to the government. They may change. There is a big expansion of the emergency department. Right now, our Emerge was built for 7,000 visits. Yeah. I want to say it's about 4,500 square feet. And last year we saw 38,000 some odd visits.
7,000 a year?
Yeah. And last year we saw 38,000 visits. So
wow.
Yeah. So really, we're really maximizing the space. We're a very lean organization, and we're really trying to develop the emergency department specifically. But it also does include some expansion of rooms. You may have heard that we're getting a level 2 ICU, which we didn't have before, so that people who require a certain level of critical care can get care close to home, rather than being shipped down to the city.
Yeah, right.
So,
well, wonderful news. We pray and we hope. I believe it'll happen. The community is always pulled through, but we know during COVID it's probably slowed down a bit. But I think the initiatives are there and it's going to happen.
Yeah, the community support has been, I would say, unwavering from my point of view.
Yeah.
Everybody who has been in the Emerge department or in the hospital knows we need a redevelopment. I mean, even Kathleen Wynne, her son was in, and he was born in the OR suite, and commented on the color of the tile, which was from '64. So everybody knows we need a redevelopment, yeah. And this community really deserves a redevelopment, and I would commend Jody for his unwavering sort of push on that.
Yeah, no, I agree with you. He really is leading the charge and grabbing the steering wheel and leading the bus on this one.
Absolutely,
right?
Absolutely.
So on the factor of COVID and possible delays, we'll stay on that subject. It's on everyone's mind. We probably in this podcast we're not going to have all the answers. It's impossible. It's just it's one of these topics that changes rapidly, etc. But we hope that we can, put out some information and some good vibes out there. And then starting with COVID and your expertise on the virus, obviously very similar symptoms to the flu bug that's coming into season now.
Yeah.
But how can you separate the two, and what is the COVID virus and what does it do to you in differentiating it from the flu?
Yeah, that's a really very difficult question to answer because we don't have all the answers about COVID.
Mm-hmm.
We do have some answers about the flu because it's been around since 1918 or even before that, I'm sure, and they've been studying it. But COVID is relatively new, so we're having trouble differentiating between the flu, regular cold virus even,
Mm-hmm.
and COVID. And in fact, just having guidelines for testing is changing so quickly.
Mm-hmm.
And now, whether it's changing because of the overwhelming number of people getting tested and the backlog in the lab, or whether or not they're actually finding out new information is difficult to ascertain. That being said, what we do know is that both the flu and COVID can be deadly under the right circumstance. You can be an elderly gentleman and get COVID or get the flu, and you can recover fully or you can pass away. It's really very difficult to know who is going to. That being said, really, if you are a younger, healthy person, you would have a better chance of immunity,
Mm-hmm.
or fighting off the virus in some way,
Mm-hmm.
than if you are an immunocompromised or elderly person.
Which brings me to my next point, and I've mentioned this on very many podcasts, that with the frenzy and the anxiety and the way the news travels around the internet, we're all available to this news and
Yeah.
putting everybody in a stir frenzy, and what can there has to be ways to better defend from COVID, and I've always focused on improving your health. Everything from improving your immune system, whether that's through nutrition, physical fitness, whatever that may be, vitamin supplements, etc. And I understand people with underlying health issues may be more at risk, but what can you do individually to say, and I put it this way, okay, I know it's coming, I know it's around me. What can I do? What are some of the measures I can do to be stronger? I may get it, I may not be able to fight it off, but I just want to improve the odds. Is that a good scenario, Dr. Myatt?
Yeah, absolutely. I mean, the two best things you can do are wash your hands and wear a mask to prevent both transmitting and having it yourself. That's how we've not had any positive cases in the hospital as yet, to my knowledge, because we wear masks, and I mean, I'm surprised they still have hands on me from all the hand washing. But in terms of improving one's overall health, I mean, it's not just about going to the gym or going at home, as the case may be, or eating healthy. It's sort of a constellation of things. I mean, a lot of it will start from up here and gaining some mental strength and talking to people and communicating and reaching out. And fortunately, we live in a time where we're able to talk to each other on Zoom. We're able to reach out to family via the internet, whereas 40 years ago we didn't have this kind of thing. So it sort of starts there, and then gaining the physical strength. I agree with you. Would be sort of next in line. Certainly, eating healthy and exercise, diet and exercise are of the ultimate importance in health. And I encourage you to speak with your doctors, your family doctors, or your nurse practitioners, or your primary care provider in finding the right sort of fit for you
in order to improve your immune system the best way you can.
Absolutely.
Right?
Yeah.
Okay, wonderful. And you did mention about the hygiene and the wearing of masks. I think the community now has evolved into that. I don't think it'll change. Even if COVID does get a vaccine and we're all cleared, I still think I'm going to sanitize my hands
Absolutely.
everywhere.
Right.
The mask may come off, but I think that area of hygiene, I think everybody is just so focused on it more now than ever before. So I think that pattern's not going to change.
Yeah, I agree with you.
Yeah.
I think it's paramount. I mean, we sort of used to just make sure you wash your hands after you go to the washroom, but now it's just make sure you wash your hands after you touch anything.
Absolutely.
And everyone seems to have sanitizers in their bags.
Yeah, and in their cars everywhere,
Yeah.
right?
Yeah.
So are you informed on the transmission methods of COVID? Is it all through the air, airborne? Is it mostly touch? Is it both? What is the feedback and knowledge you're getting back from Health Canada on what sort of are the ways that you can easily contact or contract COVID?
So it's mostly by droplet, actually. So when we release droplets into the air or onto a surface and the next person touches it and touches their mouths, or directly onto people, that's mostly how it's transmitted. No doubt there's other means of transmission on what they call fomites or things. And then probably airborne does play some role, but for the most part we think it's droplet transmission, and that's why we encourage everyone to wear a mask, because it really helps stop you from spreading.
And the wipe down and everything, right?
Yeah.
Do you have any knowledge of how long COVID can survive on a surface or anything to that matter? Is it?
It varies on the surface, actually. So I heard that, lately they've been saying it can last 3 hours, it can last 24 hours. It depends on who's touched the surface, what chemicals you're using on the surface, where it is there wind, is there sunlight? So it's really sort of hard.
So with this uncertainty again, hygiene.
Yep.
Clean. Wipe your hands. Wipe down surfaces.
You got it.
Wear your mask. And stay in your bubble.
Yeah, well, actually, the government has now scrapped the social bubble thing, and they're saying, just immediate family only, which is awful for this upcoming Thanksgiving weekend, even for ourselves.
Yeah.
But that's what they're recommending to do to stay safe.
Wow. And I can also see an upcoming dilemma coming up now with and people are starting to talk about it, and it's happening now with children going back to school, etc. The upcoming flu season, and it happens every year when my son goes to school. He brings it back, a flu or symptom. I can just imagine what's going on now with families and people going to work, their children come back with sniffles, the policy of the school.
Yes.
And
workplaces.
And in workplaces, etc. It's pretty well. It sounds like it's impossible to differentiate the symptoms to say, oh, this is COVID related versus this is flu related, but I'm going to let you tell the audience, is there any difference with these symptoms that you can sort of self-assess and say, oh, I think I have the flu, it's only sniffles. It's so hard, I would imagine.
There really isn't something that would be definitive. If you, for example, came into the ER or into my office and said, hey, I've got a runny nose, can you write me a note that says this is not COVID, this is just the cold? The answer is no, I cannot write a note that says that you don't have COVID. It's unless you have a positive test. It's even then you can have COVID and a cold. So it's kind of hit or miss, really. Unfortunately, in fact, in my own life, my son was tested last Wednesday, and we still don't have any results. So I don't have any. People are wondering if we have any pulled strings or quick responses.
It's happening to everybody.
The answer is no. We don't have an answer, and he's been in his room for 6 days. And I haven't been near him. I've been sleeping in the basement, and this kind of stuff. So
So the challenges are with every family.
Every
everyone,
family,
right?
Everyone.
The delays in testing, the protocol, etc.
Right.
So please understand that we're all in this together.
We are.
And
we are asking specifically for your patience. I mean, the assessment center's been changing. We're now appointment style only. The government put out a mandate or a directive, I guess, on Friday, and we have to work within those directives.
Absolutely.
And the people who are looking after the assessment center, very strong group of people, very strong, are working very quickly and very hard over the weekend, evenings, to try to make this the best experience that we can for everybody,
Yeah.
because nobody likes it.
Yeah. And on the subject of the assessment center, I know that, that came into play, early summer when you set up the assessment center, and now as we enter the second wave, I know that you have a much busier assessment day. I think on Monday, it was canceled this week. But, I can see the lineups. They start very, very early in the morning.
They do.
And, I know that you and your team in the hospital are working hard to possibly add more days, etc. But, it's all manpower and it's all what you are able to do. So, tell me how that is going. And I know that you're challenged because from day to day, as it spreads further, the ministry has different guidelines. So, as you had just mentioned, so what is the status right now of going to get tested?
Well, the status right this moment is it has to be appointment-based testing. So on Friday at 5:30, we had a meeting with the ministry, and their directive is that it needs to be appointment style. You can't have these long lines and people waiting 4 hours to get tested. So we had to cancel Monday, unfortunately, because we were just not able to get things sort of set up in a timely fashion. But what it looks like we're going to be doing is setting up a phone number for people to call to make themselves an appointment, and of course this will be published on various social media outlets. And you call this number, and they'll assess whether or not you may need a test and make you an appointment. So the two things that I would suggest is, if you think you need a test, please call the number and ask for the information. And secondly, if you do make yourself an appointment, please go to the appointment, because there's only going to be so many appointments
Available.
Correct. Yeah.
And I guess with this new guideline, do you have any idea on sort of how long it takes to get an appointment, or is there a backlog of, I would imagine, just like the lineups in cars,
Right.
that were in that fashion, that you may have to wait a week or two to get your appointment?
That is possible. Right now the lineup is 0 because I don't believe the phone lines are open.
Yeah.
But the assessment center will be starting, my understanding is tomorrow still. I just received sort of been in dialogue with the powers that be over at the hospital who are working diligently, and it looks like it's going to be running tomorrow.
Okay.
So I believe 8 till 1 you'll be able to make the phone call tomorrow. I don't know that the press release is out yet, but
Okay.
yeah.
All right.
Yeah, and I think this podcast will air on Saturday, so
Yes, it
so this
will,
will be
yeah.
over. But there'll be a number by Saturday for sure that
Okay.
that everybody will be able to call, and hopefully, if you feel like you need an appointment, there'll be enough.
And the
for
appointment will be obvious any time of the week, or is it just segregated to one day as it was with the previous Monday assessment day? That type of idea.
It'll be Monday, Wednesday, and Friday,
Okay.
and it'll be 8 to 4 still.
Mm-hmm.
And it'll be at the hospital for now, and
Okay.
you'll have an appointment time and you go there, so you won't have to wait 4 hours
Right.
to get an appointment.
Okay.
Or to get tested.
Is there any other means in the community to get tested? If you don't want to make the appointment and you happen to have a doctor's appointment planned in your schedule tomorrow, and you don't have symptoms and you leave it till tomorrow and you go see your doctor, can you get tested by your doctor?
In general, I think you can get tested by your doctor, but physicians are really not doing that procedure, and mostly it's due to the lack of PPE that are in our offices, along with swabbing. The government did designate some pharmacies
I heard
as
that.
swabbing centers. None of the ones in our community are swabbing centers. So if you are asymptomatic for this community, unfortunately right now we don't have a way for you to get swabbed.
And so that's right, and because without symptoms you could be walking around asymptomatic
100%.
and unfortunately probably spreading.
You could be very well, yes.
Okay.
Yeah.
In the COVID assessment that just changed for appointment only, I did see an article coming in about flu shots and how the ministry was, or Simcoe County, I believe it was, coordinating a hub or a one location for flu shots, not to overwhelm and reduce sort of walking into the walk-in clinic, getting it from your pharmacist, getting it from your doctor, and trying to sort of manage that. Could you talk a little bit more about that, Matt?
Sure. So the flu shots, the physicians have been instructed not to give any flu shots until November 2nd. So that's the first date that you can get that. Not Simcoe County, but the local community of physicians is organizing a way for everybody who needs a flu shot specifically to get flu shots. So there's people who need flu shots. So those are who are eligible, like over 65 and are at higher risk. Going to be trying to get them all vaccinated without having to actually go to their doctor's office to get done. So much like the assessment center, there'll be an appointment. You call a number and you come in. This isn't finalized yet, and by no means is this guaranteed at the moment, but it is something that the local community of physicians is working on. And so that's what we want to do. We want to provide a safe environment to administer flu shots with as little contact with other people as possible.
Okay.
Especially for that community that might be a little bit older.
Yeah. And in the subject of vaccine, and I didn't bring up this question with you, but are you and your physician community and at the hospital, are you getting any news on sort of advances on treatment, vaccines, outside of what we're already reading on the internet?
The Trump treatment for COVID.
Well, he got in and out.
Yeah,
didn't
he really did. Yeah. The answer is not really. I mean, there's nothing that I know of that is a definitive treatment for COVID. We definitely don't have an approved vaccine here in Canada, although you do read, positive studies.
Trials.
But we don't have anything approved yet. So unfortunately, I wouldn't be able to comment really too much on that, except for I know they're working on it, and hopefully it's soon, and hopefully it works.
Yeah. Are there any advanced treatments of someone who contracts COVID and has to be hospitalized? Have you found out more on methods of treating someone in the hospital, and I have no knowledge whether it's more oxygen, I don't know the methods, but are methods improving to care for people that contract COVID and are in the hospital? Or
so they are doing a lot of trials at academic centers. I'm not sure there is one particular regimen that is helping anyone more than the other regimen at this point, but certainly I know there's a lot of trials going on with that.
And trying. Good.
Yeah.
Well, we're coming to an end here. I don't know, Matt, if there's anything you'd like to say to our listeners. I'd like to emphasize that, I feel like, and why I wanted to bring you on the podcast was with all the news and negative news we're getting of COVID, and God bless the residents at Simcoe Manor, and God bless what's going on there with the outbreak. But it just feels like, the COVID noose is getting tighter. New Tech has been pretty. It's not downtown Toronto.
Yeah.
Right.
No, thankfully.
And the cases here, have not been very much. There's been a few, but I sense that it's getting closer. It's around us a little bit more and more. We all have to get through this together. Take care of your hygiene. Wear a mask. Be polite. Be patient. Everybody's going through the same thing. Nobody has an edge on anybody else. And we're going to get through this together. We just got to be patient and get through this together. And I think our community is one of the best communities around. Like, we have everything here.
Well, that's why we live here.
Yeah, it's just the best. Yeah, no, it's
true.
It really is the best community around. To have so many physicians in a community of 38,000 people, like, you came in here at the grassroots level. What has this community done? A med center downtown, attracting physicians and services like no other community, really.
We do have a lot more services now than we had, in 2011. The Alliston Diagnostic Center is another one.
Absolutely,
from a medical perspective, anyway.
Yeah.
It's really encouraging to see, people sort of following the rules and following the guidelines. It's really hard to get the information out there to people because they, are scared and they unfortunately feed off of some things that maybe just aren't true, or maybe they are true, and they're scared. And so, we just, especially in the ER, when I see people, they're scared of getting COVID, or they're scared of having to come into the hospital with their other thing and possibly getting COVID. And we just try to understand their situation and treat them like you would want to be treated, I would say.
Yeah. And a shout out to you, Dr. Myatt. I mean, for, when we got shut down, and everybody's at home, you were still at work,
Wow.
To the extent that you could be.
Right, right, yeah.
But you were definitely jumping into the front lines quickly and adapting.
It brings up a point, actually. So when COVID first came to Canada, it was March 14th.
My birthday.
And I was...
Turned 60.
Oh, geez. 60?
I turned 60.
Wow, you're looking
it's
great,
the most memorable birthday ever.
I bet.
Yeah.
I bet. Well, I was in Hawaii.
Oh,
celebrating your birthday.
Oh, there you
yeah. It wasn't much of a vacation, so I left for Hawaii far before that, and then we never expected what happened.
Yeah.
And we could not get back on a direct flight. We would have had to go to 3 airports. Well, we were scared. We didn't want to do that. And when I got back, I had to quarantine for 2 weeks. I could not actually go to work, which was devastating. In fact, I got shingles from the stress of it, if you can believe it.
Oh, man.
So we quarantined for 2 weeks at my house. We had some great neighbors. We had some great friends who brought stuff by, and thank goodness for Zoom and Teams meetings and things. I was able to do a lot of administrative work from home.
Yeah.
So we survived, but that's I was jumping into the fire, but I couldn't jump because I was quashed at home.
You just had kindling. That's
right.
all you had.
That's exactly right. But after that, it was fuel to the fire for sure.
Yeah. Well, you're in the trenches, and I admire and appreciate what you do for this community, and everyone. We have just amazing services, medical services in the community, and as you heard earlier in the podcast. Fundraising, supporting. They want to expand.
We have to expand. It's not my hospital. It's not the doctor's hospital. It's not the administrator's hospital. It's your hospital.
Yeah.
And so I would impress upon the listeners that this is in fact true. This is your hospital. This is not our hospital.
Yeah.
Also, my hospital. I live here too.
Right.
And so if you can donate financially, if you can donate your time. If you have any ideas, please call the foundation. If you see me, you can stop me on the street. I'm happy to listen.
Yeah.
So
wonderful. Well, that's what this community is all about. So I hope this podcast helped you. Ease your anxiety a bit. We're all going through the same thing. This gentleman here, chief of ER at the hospital, Stevenson Memorial Hospital, family physician, as well on a short period of time over at the Mill Pond Medical Center. His advice to you and his knowledge to you that, we're all in this together, and, clean your hands, hygiene is important, masks, immune system, health, right? Keep that, maximize that where you can, so you can be the best that you can be. Any last words, Dr. Myatt?
I actually have a couple of questions for you, if you don't mind.
Okay.
So if I was watching this podcast and I wanted to follow along to more other podcasts, and you didn't preface me with this question, just so you know, or listening to this podcast, how would I find you?
Oh, nice plug. Thank you. I
like
appreciate
that?
it.
Yeah. And you didn't ask me.
I didn't write that down and ask you
Yeah.
for any sort of plug in there, but I appreciate it. TNT Weekly. You can find me on all your favorite podcast directories. TNTweekly.com on my website. Follow me on Facebook, Twitter, Instagram, and it's all there.
Yeah.
Yeah.
Well, that's how I found you.
Okay. Well, there you go. And I know how I found you.
No, please don't. Actually, no. We don't want to see you there.
All right.
Yeah. I actually have Instagram as well. If you want to follow along, it's at MyattMD.
Yeah, and you've got some great postings there.
Yeah, we have fun. We have some fun up there.
Well, you got great comrades and associates, all the docs at the hospital. It's a great community. Okay.
amazing
Dr.
team.
Matt Myatt,
Thanks
Chief
for
of
having
VR.
me. Thanks
You're
a lot.
welcome.
Really appreciate
All right.
it.
See you on the next episode. Ciao.
I'd shake your hand, but you know.
No,
Yeah.
one of those maybe.
Like this.
Like this.
There we go.
Okay, ciao. That's it.
Good.
Done. We're done.
Amazing. That was fun.
Wasn't that good?
Yeah.
I told you, man.